This is a very exciting time to be doing what I do, to be a physician, a surgeon who is offering these operations. For as long as human beings have existed, there have been transgender people. This is the first time that we have the capability, the technology, that we can provide the ability for transgender patients to have a surgery to align their bodies with their internal gender identity. The types of procedures that are available fall into very broad categories, male to female and female to male. Those are just sort of like an overview of the different sorts of procedures that we offer. A male to female operation, we can do facial feminization surgery, which is taking sort of the more masculine aspects of a person's bony structure and their skin, their nose, their chin, and the overall proportions of the face. We can do a tracheal reduction, right? The trachea is a big marker for masculinity. It grows at puberty. In someone who wants to present as female, we can reduce the trachea, the size of it. We also do breast surgery. On the male to female side, that usually takes the form of breast implant, breast augmentation. And for what we call bottom surgery, which is colloquial for genital surgery, we'll do a vaginoplasty. And on the flip side, female to male operations, the more common things that we do are breast surgery, which involves masculinization of a chest, usually some sort of removal of breast tissue and recreation of a more masculine nipple and areola. We'll also do bottom surgeries, which can take the form of a phalloplasty or creation of a penis. In a patient undergoing vaginoplasty, they can have receptive penetrative intercourse and they can have orgasms. Those are two big pluses from having a vaginoplasty. And in a patient undergoing phalloplasty, after they undergo placement of an erectile device, they can have penetrative intercourse as well. The vast majority of patients who have had phalloplasty also report being able to have orgasms as well. Talking about complications before surgery is one of the more difficult things that I do, but I feel it's so important that patients understand all the possible bad things that can happen after surgery. And, aesthetically, we may create something that isn't perfectly in line with what the patient wants. And so we do offer revision surgery. Sometimes it does take more than one operation to get the outcome that the patient desires or is expecting. I'm always surprised that 99% of patients, after hearing all the complications, will still want to proceed with surgery. I think that just shows how important these operations are to our patients.